A report by the Auditor General in March revealed significant mismanagement of COVID-19 funds. As of today, Uganda has confirmed 52,935 COVID-19 cases, 47,760 recoveries, and 383 deaths. It's upon this background that Afrobarometer, a Pan-African non-partisan survey research network, conducted a study on citizen views on COVID-19.
Very many Ugandans, close to 9 in every 10 Ugandans, say they are well informed about COVID-19, and they are also very well informed about strategies to combat COVID-19. The results also indicate that more than a half, 55% of respondents, did say that COVID-19 did affect them, impact them negatively. Many of them lost jobs, lost income, and many lost businesses. Results also indicate that close to 9 in every 10 Ugandans did support the lockdown that government enforced beginning in March, even though they were aware that this lockdown will have negative impacts on the economy and on people's livelihoods. They nonetheless accepted it. The survey also shows that a big number of Ugandans, 67%, did report that they found it very difficult to comply with the lockdown, that it was difficult, and also that government assistance did not come, and only 19% say their households did receive some government relief during the lockdown. They also indicate that the government assistance packages were not distributed fairly. Okay, some 55% of the respondents did say so. Also, very important, we see that very many Ugandans, okay, 8 in 10 Ugandans say government did very well in managing COVID-19 response at the time, but that there are big questions people ask about corruption tendencies, and also fears that government officials and politicians in particular could use the pandemic as an excuse to enrich themselves economically or to increase their power and authority in the country. With regards to the vaccine, about 71%, 7 in 10 Ugandans say at the time, they said at the time in December, that if a vaccine became available, they would most likely try to be vaccinated if government says it is safe. But the proportion of those who think that government, this is 47%, believe that government may not be able to identify, to recommend a safe vaccine. So there were fears about vaccine safety, particularly maybe from what people saw on the news or in social media from elsewhere.
According to Afrobarometer survey, more than 8 in 10 Ugandans, representing 82%, say that government has managed its response to the COVID-19 pandemic fairly well, all well. But about the same proportion of 81% believe that some or a lot of the resources available for responding to the pandemic were lost to corruption among government officials. The report indicated that nearly 8 in 10 Ugandans, representing 77%, worry about public servants and politicians using the pandemic to enrich themselves economically or increase their power and authority, which accounts for 71%. About the lockdown in the country, the study found out that about 89% of Ugandans said that the lockdown was necessary to prevent COVID-19 infections despite difficulty in complying, adding that relief aid was distributed unfairly. When asked about their willingness to be vaccinated despite doubts about vaccine safety, the study found out that almost 3/4 of Ugandans said that they are likely to try to get vaccinated against COVID-19 if a vaccine becomes available and if the government said it is safe.